Started. So, welcome everyone. Welcome to Advocacy Made Simple, where to begin. So, whether you're new to advocacy or whether you're looking for some tips, you have come to the right place this afternoon, I should say. So let's just take a minute and review New York ACP's mission. It is broken down into three segments: education, quality improvement, patient safety, and advocacy, which is why we are gathered here today. And New York ACP has a very important committee, and that is our Health and Public Policy Committee. It is chaired by Dr. Kellen King from Rochester, New York. Our vice chair is Dr. Shelley Gums from the Manhattan, Brooklyn area. And I am New York ACP's executive director. I am the staff liaison, and I'm also a New York State registered lobbyist. And I am assisted by Patrice Gessner, who is also a very valuable member of the New York ACP team. So every year, the Health and Public Policy Committee is tasked with putting together a legislative agenda. And we do that under three categories, and that is purposely. And the first category is access to care, healthcare delivery. The second, public health. And the third, quality of care and patient safety. Although these are our three main categories, there are numerous topics that fall underneath each of these, as you will see here. Now, and this particular slide you can find on New York ACP's chapter website under the Advocacy tab. As you can see, each of these bullets, there's so many more that can be added, but the Public Health Committee has purposely kept them broad. So don't feel like we didn't include a topic or two or three or four or numerous more. This was strategic. We purposely kept them to a minimum. And this year, we have New York ACP's Advocacy Day scheduled for this coming Thursday. It is held during our Advocacy Week. And we're also scheduled to have a delegation going to ACP's Leadership Day in Washington, D.C. next week. And as I will mention a little bit later, our Advocacy Week taking place beginning today has a lot of really good activities. So I'm glad you joined us today. And thank you for joining. Thank you for spending your lunchtime with us. I hope you're eating while you're listening. And I hope you're able to join us during lunchtime Tuesday, Wednesday, and Friday of this week. So this is our sixth annual New York ACP Advocacy Week. We all know why we're gathered today, but tomorrow is really an exciting webinar. It will be on the New York Health Plan, which is the single payer system, which some of our members may know. It was just a different name years ago. And we invited the original author of the New York Health Plan, former Assembly member Richard Gottfried, otherwise known as Dick Gottfried. He was a member of the New York legislature for more than 50 years. He chaired the New York State Assembly Health Committee, and we are delighted to welcome him tomorrow. On Wednesday, we are having a virtual advocacy town hall, and it is on the topic of misinformation and disinformation. And we are thrilled to have Dr. Daniel Pomerantz, a master of the college, kick off the advocacy town hall. So please don't miss that exciting activity with us. Again, bring your lunch and plan to spend 45 minutes with us. And then on Thursday, we are having our Advocacy Day in Albany. There will be a small group of leaders visiting our legislators. However, on Thursday, there will be a member call to action that will be sent out to all of our members on the topic of the Primary Care Investment Act. And we would ask that all of our members send a prepared letter electronically to your legislators in Albany. And it's prepared, but feel free to adjust it, make any comments, share a story. They need to hear from all of our members. So please take a few minutes. And then on Friday, Dr. McDonald, our New York State Health Commissioner, has graciously agreed to spend lunchtime with us talking about vaccinations and public health issues in New York State. So an exciting week planned. Again, the three topics we are going to talk about while meeting with our legislators in Albany on Thursday include the Primary Care Investment Act, the Mis and Disinformation Bill, and a telehealth bill that is also extremely important. Now, if you don't know who your elected officials are, that's very easily rectified. We have a tool on our website under the Advocacy tab that can get you that information. And if you go to the Advocacy tab, you start by plugging in your zip code and you follow the additional prompts. You will be able to come up with a list of all of your elected officials, all the way to the top. That includes the president, all the way down to your state and assembly representative. If you have any difficulty at all, please don't hesitate to contact me. I'd be thrilled to help you gather that information. So let's take a look at our lobbying goals for today and just to kind of quickly go through them. So I'm going to make an assumption, which one is supposed to never do, but I'm assuming that since you're with me today, you're interested. So if you're interested and you have an issue, I think that tells me that you should get involved in the advocacy process. And so it might be a good idea to start by creating and building a relationship. How do you do that? It's a good idea to maybe schedule a meeting with your local New York State Assembly, Senate, and congressional representative. You can do that in person or virtually. You can attend a local event when possible. That's a great way to make an introduction or have a conversation. You can participate in New York ACP's annual Advocacy Day or in ACP National's annual Leadership Day. We'd love to have you do both. and become an important and valuable resource to your elected officials. I believe that they would love to build a relationship with you. And why? Because you are the medical expert. You have the ability to influence change for better quality, for better healthcare delivery for all New Yorkers. So there's three stages of a legislative meeting, and I'm going to go through these with you. So there's before the meeting, there's during the meeting, and there's after the meeting. So before the meeting, what do you want to do? You want to pick a date, a time, and a format. So do you want to meet in person or do you want to meet virtually? The chapter for one has done both in person and virtual. During COVID, we met virtually. Prior to COVID, we met in person. And now we've transitioned back to in person after COVID. We want to schedule legislator appointments. So when you do that and you get into the meeting portion, you want to remember you need to identify yourself. And when you're scheduling appointments, you want to be sure you identify yourself as a constituent. Because I can tell you, if you call a legislator's office and you just say, "Hi, I'm Dr. Smith. I'd like to make an appointment with Assembly Member Jones," they're going to say maybe, "Oh, Assembly Member Jones is really busy. I don't think we're going to be able to accommodate that." Thank you very much. Maybe another time. But if you called and said, "Hi, I'm Dr. Smith. I'd like to make an appointment with Assembly Member Jones. I'm a constituent of Assembly Member Smith." I'll bet you're going to get an appointment regardless how busy. You also should be forthcoming and share what your purpose or your issue is. It's good to do that because they're going to ask you why you want to meet. And you also want to share who will be attending that particular appointment as well. You also want to get organized. You want to pick if you have just one issue, great. But if there's two or three issues, you really want to get organized. And you also want to plan for the meeting to last between 15 and 20 minutes because that's the typical time frame. You want to develop talking points and you want to put together and prepare some leave behind materials. Most importantly, you want to know what your ask is because you need to get to the point. If it's a group meeting, you will want to brief in advance and you will want to appoint a group or team leader. Also, very important, you want to do your homework. You will want to find the bio of the legislator or legislators that you're meeting with. You want to review that bio for any commonalities, take a look at the geographic or demographic information. You want to look to see what committee service they're involved with. You want to see what bill sponsorship or co-sponsorship they are involved with or they've taken on. Very important. These can be really important icebreakers. It creates and breaks the tension, or it kind of breaks down the initial, everybody looking at everybody in the room. It just creates a more friendly meeting. If meeting independently, you may want to consult with New York ACP in advance to see if we can give you any information that might be helpful on the topic or topics that you're planning to discuss. During the meeting, Briefly introduce yourself, where you're from, describe your job, your patients, etc. If you're meeting as a member of ACP or the chapter, we definitely want to share our mission and goals. What I would see, what I do recommend that if you're meeting on your own, don't take up too much time with introductions. Why? Because remember, you only have 15 or 20 minutes typically. Um, Also, extend any possible thank yous for any bill support and or bill passages. You want to present the issue, be succinct, and use your own words. Be confident and remember, you are the expert. Make issues relatable. Provide real life situations that demonstrate the problem. Use personal examples. Share stories. They are important. They make your issue memorable and give it credibility. Lawmakers love stories. That's how they remember you. That's how they remember the issue. Be courteous and polite, but firm with your requests. While most of the time your meetings are informal, it's still a business meeting. And you also want to listen to his or her perspective, but present your views. Provide leave behind materials at the end of the meeting. They are leave behind materials. If you give them the leave behind materials at the beginning of the meeting, it will be distracting to them and they're not going to listen to you. Make the ask, be clear, say thank you, exchange business cards, take pictures. Don't forget, our senators and our assembly members love to have their picture taken. And also, it's a great thing. It's always nice to have your picture taken with them. After the meeting, within 2 weeks of the meeting, sooner if possible, but we know everyone's busy, send a quick thank you to recap the meeting highlights, any legislative commitments that were made, and your availability on future issues. Important. That's building a relationship. Follow up with the staff because building a relationship with legislative staff members can be equally as important. Most staff prefer email. So also what you want to do is tie up any loose ends from the meeting, such as support for a bill. If there was any discussion, any promises, you want to put that in your follow-up. Answer any questions. If you promise to get back to them, do so. Don't make any promises and don't keep them. You want to make sure you provide answers to questions that were asked of you. Consider follow-up and or scheduling future meetings, maybe back in the district when it's more convenient for you and or for both of you. Here are some tips for effective advocacy. Again, you are the most valuable resource when it comes to health-related issues. You went to medical school. You are practicing physicians. You know your patients. You know what's most important to your patients. Also, check in with New York ACP in advance on policies and or positions. Also, leave behind materials should include extensive information to support the issue and the ask. Stay on target. On subject matter, be accurate, brief, and or add something new. Also, you want to be accurate. Don't give them something that you're not positive about. You will enhance your effectiveness with a friendly exchange of ideas. That's always important as well. Always remember your own personal experience as a physician is your most effective advocacy tool, and stories I put here, stories are very good. Stories are fantastic and so very important. Include medical students and residents in legislative meetings. In my experience, when there's a variety of different levels of physicians in a meeting, somehow our legislators always look to the medical students and residents, our physicians of the future. I don't know what it is, but again, if there's some way to include them, do so. If there is agreement, get that legislator's commitment to take specific action. Again, if you don't know the answer to a question, it's okay. Or if additional information is requested, it's okay. Offer to obtain, but remember, follow up. If informed at the last minute that your meeting will take place with a legislative aide, graciously accept. Do not cancel the meeting because staff members are often instrumental in shaping a legislative member's view, and they can be an excellent contact. Not just a good contact, but an excellent contact. They can be your best friend, let me tell you. Things to avoid. Leave your Senate and Assembly member or staff member guessing what you're asking them to do. Be clear, be specific, and make the ask. Reading directly from a leave behind document, a script, or handing leave behind materials to a staff member at the beginning of the meeting is a no-no. Being ill prepared, either on a topic matter or with your lawmaker, is not a good way to go into a meeting. Mentioning financial support in a campaign you do not want to do. Directly quoting staff or the lawmaker on social media, a big do not do. Distractions during a meeting, such as checking your mobile device or texting or sending emails or constantly checking your phone or looking or acting overly disappointed if you get pushback on an issue. You need to always remain professional and respectful. What you want to remember, similar to physicians, legislators are extremely busy. They are responsible for attending committee meetings, attending sessions, voting on bills, meeting with constituents and other groups, reviewing their own mail, press clips, various reports. For elected officials, work can continue into the evening with receptions and fundraising events. So they're busy too. So we do need to remember that. Advocacy engagement opportunities. These are things that really can happen. So if you're interested in even getting more involved beyond with New York ACP or with ACP, during meetings, ask your elected officials if they have a mailing list for healthcare issues. Maybe offer to volunteer to serve on any physician roundtables they have. Or do they have any advisory committees or some other healthcare meetings where you could join? If none exist, maybe you can suggest one, and maybe you can start one. And I'm sure they might welcome it. So again, it doesn't hurt to ask. Again, scheduling periodic meetings with your local assembly person, senator, and congressional representative is a great way to building relationships and continuing relationships. Inviting elected officials to participate in a chapter, regional, or district event is something to consider. Extending an invitation for an on-site visit to your office, hospital, clinic is a good way to make elected officials understand more about healthcare, more about taking care of patients, or if there's an issue that you speak to them about and they'd like to know more about it, it might be a good educational experience by doing one of those things. Um, Also, in it could go either way. If there's a town hall that you're going to or that they host, get involved. Invite them to get involved or participate in one that they're having. Show up, join them. Again, we talked about New York ACP's member call to action. So one will be coming out to all members this week on Thursday, May 7th. ACP National also conducts member call to actions. Their member call to actions consist of federal issues. So look for them as well because they want to keep ACP members updated on federal legislation while we, the chapter, do our best to keep our members updated on state legislation. At the federal level, meaning the ACP level, there is a opportunity to join AIM. It stands for Advocates for Internal Medicine Network. It's free. Please join, sign up. It's really simple and easy. If you go to ACP's website, you click on the Advocacy tab, you can join Advocates for Internal Medicine. And by doing so, you will get notification of federal legislation to keep you updated. And that can be your way of getting more involved. And from there, you can also get more involved, or you can just stay updated. But that's up to you. We'd love, of course, for you to get more involved. So, I could go on and on because I'm very passionate about legislation. Aside, as I mentioned earlier, aside being your executive director, I am a registered lobbyist. I wish I had more time for legislation. Again, it's a passion of mine, but I'm going to stop here and take any questions that anyone may have from my presentation today. I want to thank you all for joining me. Thank you for patiently listening to me this afternoon. Again, thank you all so very much.
It's like Dr. Pomerantz has a question.
Dr. Pomerantz, how can I help you?
Hey, not really a question. Although I do have one little one. Before Wednesday, could you send me the misinformation bill that's in the state? Because I want to see if there's anything I should say about that, given my experience at the BOG. But as far as meeting with legislative aides, um, generally, it's actually more impactful to meet with a legislative aide than to meet with the legislator. They know about the issue. They'll ask more informed questions, and they'll tell you what you may get some insight into what they're advising the legislator to do. There's also, if you remember the movie My Big Fat Greek Wedding, where the father says, I am the head of the family, and the mother says, he is the head of the family. I am the neck. I turn the head whichever way I want it to go. The legislative aides are the ones who are giving the advice to the legislator. They're the ones who are writing the policy papers. They're the ones who are reading constituent input on those issues. So they're really the ones with the input. So you may actually have more impact meeting with an aide than meeting with the legislator themselves.
Very true. Very true. Yep. And also, today's presentation it is being recorded and we will post it to our website. We will also put an article in our next newsletter letting the rest of our membership know, and we will be pointing them to where it is on our website, so that they too may have an opportunity to listen to this. And hopefully, they will be able to learn more about advocacy and get more active in advocacy. Um, Also, we have our chapter does offer a advocacy internship program, and I am delighted to work with medical students and residents on the advocacy internship program. And it is a 4-week program. It is just like dipping the little toe in on advocacy, but there's so much more. And so I hope that when they do their exit interviews and when they do their podcasts at the end of their internship, they are excited, and I think they're on their way to continuing the advocacy that they've started. So I hope more of you and those that will listen to today's webinar to kind of continue and or start advocacy efforts. But I want to thank everybody, but I'm happy to take any additional questions. Okay. Well, everyone should know how to reach me. If not, my contact information is on the website, and complete contact information is in any of my emails. So I want to thank you all for joining today, and have a wonderful afternoon.